Hi there, and welcome to COVID-19 Now What, a weekly video series from the Easthampton Health Department. I'm Amy Hart, public health nurse, and today is April 9th, 2021. This week, we'll first take a look at the latest data for Easthampton, and then I'll answer some questions and clear up a few popular misconceptions about the COVID vaccines. First, I'll share the dashboard with you so we can discuss that. Okay. This week's Massachusetts COVID response report, which comes from the Department of Public Health, was released on Thursday, April 8th, and it covers data from March 21st until April 3rd. I want you to hold that in mind. There's about 6 days of time lag from when this data was released up until now. And so if we look across the top cells in this dashboard, you'll see that they are all yellow, indicating that we remain in the moderate risk zone for both Easthampton and Hampshire County. However, what these actually represent, you see up arrows showing increases, in particular for the 7-day average and 7-day test positivity, the most recent numbers the state's reporting for us. These are very slight increases over the previous reporting period. So I want you to hold that in mind, both the time lag and that these are slight increases, as I now draw your attention to the purple left cell, which is called past week case trend. So this runs Wednesday through Tuesday. It goes up until April 6th. So it's a more recent week than the state's 7-day week that they report. Last week when I shared this info with you, in this cell, we saw a 10% decrease over the previous week. This week, I'm happy to report a 42% decrease over the previous week. So we are headed in the right direction, and it seems that we are picking up speed. So despite what's showing in the top, I just want you to hold that in mind. It doesn't mean we're out of the woods, though. We are definitely clearly in the moderate risk zone still. And in fact, something I'm not able to find space for on the dashboard is the information for Hampden County, which of course involves our very near neighbors, many cities and towns in that county. Many of us move in and out of all the time for work, school, shopping, or other activities. And so what's happening there is really relevant to us as well. What we see is that where Hampshire County in the upper left yellow cell here has 18.1 cases as their daily average per 100,000. For Hampden County over the same period, it's double that at 36.4. And similarly, the test positivity rate for the past 14 days, that reporting period the state uses, for Hampden County, it's 4.9% compared to Hampshire County's 0.66%. So a really big difference. That's very local to us. And it means that we need to remain vigilant as we go about our business in the area, well-fitting, well-filtering masks, social distancing, and truly getting vaccinated as soon as we possibly can. All of these are more important than ever. And I also want to include staying home if you or a household member is sick and you have not yet ruled out COVID. So let's move on to the vaccination section, my favorite. On the far right blue box, we can see that 43.5% total, that's adding the full and partially vaccinated populations together, 43.5% total of residents in the 01027 zip code, Easthampton, Westhampton, have now received at least some vaccination immunity. Well, they're somewhere along that journey. Maybe they just got their shot, but they have at least had one shot. So that is really exciting to see. And I'm hoping that in the second half of this video, when I talk about misconceptions and questions people have had recently about the vaccine, if you are one of the people who is feeling hesitant about getting the vaccine, I'm hoping that that will help push you a little bit closer toward deciding to get your shot. We will wrap up the dashboard by focusing, as always, on the center graph here. This week, I've pulled apart several large age groups so that we can look at trends in new cases over the past 6 months. I think if we focus on the yellow box, this is the 61 and older group. And we go to the right of the graph, we see that between February and March, we actually had a pretty big drop off in new reported cases for this group. I believe this is due to the vaccine. Since we, as a state, had focused on vaccinating this most vulnerable older population first, I think that we're now seeing the benefits of doing that. And I'm hopeful that as the vaccine is rolled out to all the other groups, we will continue to see cases dropping as well. One question I think people might have as they look at this, if you look at the blue columns, which represents the age group 0 to 20 years, a question I am hearing as schools are having more of their students come back on campus around the area, around the state actually, and more will be coming back on by April 28th, actually. One question I'm hearing is, what about transmission in the schools? And thankfully, we have not been seeing that yet in Easthampton. It may occur occasionally, but we're not seeing it so far. What I think the increase from February to March, for example, for this age group, I think it probably more likely reflects the increase in the B117 variant, which is much more contagious than the original wild SARS-CoV-2 virus. And I think this is probably something about household transmission. So when I make calls and one person has had the virus, I am finding out that within a day or two, often everyone else in the household ends up having it as well, either become symptomatic or they get their test back and they too have COVID. Just super efficient household transmission. So I want to encourage everyone to avoid public interactions if anyone in your household is having symptoms or has tested and is waiting for their result. There is a high chance that you too could have already become infected. So stay home until you find out, or if the person does end up being positive, stay home until your incubation period is almost over. And the contact tracers or myself, if I call you, will advise you on the specific time period based on symptoms or testing. So why don't we step away from the dashboard and we'll move on to the second part where we talk about vaccine myths. Give me just 1 second here. I want to pull up the information I have for you. Okay. So the first thing that I often hear on the contact tracing calls, people have this idea that if you have already had the virus, you don't need to get vaccinated. Now, while it's rare, reinfections do occur, and they may be more likely now that certain, as we keep talking about, variants of the virus are in circulation within our communities. So what happens is getting vaccinated prompts your body to produce even more antibodies to fight future exposures. And with more contagious variants out there, the more antibodies you can produce, the better. Now, many people don't realize that even if you have had COVID recently, you can get vaccinated as soon as you're out of your isolation period. Yes, you have natural immunity that will protect you almost entirely from getting a reinfection within 90 days. But there is no reason to delay your vaccine if you are among the eligible group and you can get an appointment. The only exception to this is if you are someone who has been hospitalized for COVID recently and you received monoclonal antibody treatment. This is an IV treatment that people with severe COVID or moderate to severe COVID symptoms can be given in the hospital. If you're part of this group, the CDC does recommend that you wait 90 days from then before being vaccinated. The reason it's not anything to do with a negative impact on you, but the vaccine itself may be less effective in your body because those antibodies are already present. And your body won't respond in the way that we want it to when it gets the vaccine introduced into its system. So a second question that I often hear has to do with which vaccine to get. And I hear people still saying, that the J&J vaccine may not be worth getting because it's not as effective as the Moderna and Pfizer vaccines. I just want to emphasize all three of them provide 100% protection against death from COVID and almost as much protection against severe symptoms. That is the bottom line. It will keep you alive and keep you off a respirator, right? The only real difference that we can say between them is in their ability to prevent any infection at all from a COVID exposure. So yes, the lowest rate of protection does come from the J&J vaccine at 66%. And the other two are in the middle 90%. So there is a difference. I would consider it extremely minor in the overall picture. If I have a chance to get any of the vaccines, I would jump at it, and I encourage you to do the same. Unless you have some reason, maybe an allergy to one of the components, and then that would make one of the vaccines better for you than the others. Third one I hear sometimes is that getting vaccinated can either give you COVID, or more commonly I hear it can make you test positive for it. Now, these are just not true. The reason is that none of the vaccines carry live virus in them. This means they cannot get you sick with COVID, and they cannot make you test positive. There isn't any viral material being transferred into your body the way you would if you were actually exposed to someone with the virus. So those cannot happen. Where I think some of the confusion lies is that some of the vaccine's possible side effects, such as headache, muscle ache, or fever, of course, overlap with the more common COVID symptoms as well. So, my advice to people is if you get vaccinated and you do have these symptoms, stay home for a day or two if you can. I understand some people may have to go right back to work, but if those symptoms last more than a couple days, get tested, or at least talk to your doctor about getting tested, because the incubation period for the virus, remember, is 14 days, and you could have been exposed prior to getting your shot. And so you would have the virus already within your system as you then get the vaccine. And then also it takes a couple of weeks for the vaccine to get your body to produce new antibodies in response to it. So what that also means is for that couple of weeks after you've been vaccinated, you could be exposed to COVID and contract at that point as well. So don't just think because you've got your shot, there's no way you can possibly have COVID at that point. A fourth one I do still hear is an assumption that it's not safe to get vaccinated if you are pregnant or breastfeeding. There are studies currently underway to have more definitive information about vaccine outcomes for pregnant and lactating people. However, the safety does seem pretty clear. We have animal studies from the vaccine, and we have observational data from the millions of people who've gotten the vaccine already so far, suggests that there is no difference for this population in terms of side effects from the vaccine or the protective qualities of it. It also seems, again, this will have to be studied in a more systematic way, but it also seems that the antibodies created by the vaccine may actually be passed on to the child through the placenta or via breast milk. So that's exciting too. You may be able to protect both yourself and your child by getting the vaccine. But if you have questions, the person to talk with is not Google, it's your doctor or your midwife or your nurse practitioner. So please do that if you have more concrete questions about your particular situation. I do also want to point out a consideration, which is that pregnant people are, it seems, at increased risk for COVID complications if they do get the virus. So that would be another thing to hold in mind. This is maybe a smaller group of the population, I'm not sure, but the idea that transplant patients and people who take immunosuppressants should absolutely not be vaccinated. Again, this is one where you will definitely want to talk with your doctor or medical provider. There is no prohibition against getting vaccinated for these groups, But because most people in this category will be taking an immunosuppressant medication, which we know can reduce the effectiveness of the vaccine, your doctor may advise something like a medication vacation prior to getting vaccinated, or just want to provide consultation with you on the actual level of protection you should expect from getting the vaccine. Again, one thing to hold in mind is that people with autoimmune disorders may be at greater risk for COVID complications. So an important group to get vaccinated if possible. A couple more things I hear, not as much lately. One is that the vaccine can change your DNA somehow. I want to emphasize that the current COVID-19 vaccines authorized for use in the US are all non-replicating vaccines. That means that when they are, when you get your shot and the vaccine enters your system, it does not make copies of itself. It does not interact with your cells directly. What it does is it provides a signal to your immune system to develop a specific type of antibody to target a specific protein that the vaccine carries. So it's a specific antibody your immune system is told to make to ward off the virus, and in particular, targeting, we've all heard by now, the spike protein. That's how the mRNA and viral vector vaccines are targeting the proteins on the outside of the virus cells. So again, what that means is the vaccine does not enter your cells, does not reproduce inside them, and does not modify them in any way. And then the last one, I heard this a lot more at the beginning of the vaccine distribution, not so much lately, but this idea that the vaccine can damage your fertility. I just want to share a statement that was released last month from the American College of Obstetrics and Gynecology. And they say, while fertility was not specifically studied in the clinical trials of the vaccine, no loss of fertility has been reported among trial participants or among the millions who have received the vaccine since their authorization. And there is no sign of infertility that has appeared in animal studies. So we'll take it from them that the vaccine does not impact your fertility if that is your current concern. That's all I have for today. Thank you so much for watching. Please do get in touch to the health department through our website, on the city website. If you have ideas or topics that you'd like me to cover in an upcoming video. Until then, stay well and protect yourself. Thank you.